there. I am Dr Jacobus Vlok. I work as a VASER Liposuction specialist throughout the UK. I've been doing this full-time since about 2011. Up to date, I've done around 1,000 patients, and at this point in time we work in all the different cities, including Manchester, Leeds, London and Nottingham. Okay, VASER Liposuction is a technique whereby we make use of ultrasonic technology to liquefy the fat in the human body before it's gently extracted or manipulated or displaced. We are quite keen to call it liposculpting instead of liposuction, because most of our patients are already quite fit and they've just got these unwanted pockets of fat that they just cannot shift in the gym, and that is where we come in. We have the privilege of having access to not just VASER technology, but also to all the other modalities of available to the technique of liposuction in the world today. The beauty of VASER liposuction is that we use very small incisions, usually placed where they're not visible after a few months, and also with VASER technology it enables us to treat various parts of the human anatomy, starting at delicate parts like the human chin and neck, and we can go all the way down to the ankles, which we commonly call cankles. And also with VASER liposuction we are now in a position to make a very, very good task of treating the man who's got excessive fat in the chest, and also include the basic removal of the glandular tissue in the chest, all through little stealth incisions with minimal trauma and bruising to the patient. When a patient comes in on the day of his treatment for VASER liposculpting, they will have to allocate anything from half a day to a full day for their procedure. They will arrive at the clinic. It also depends on whether they have it under local or sedation. Depending on the magnitude of the case, we can make a decision on that. They will arrive, they will be photographed, and then we will do some planning on their skin with marker pens. They will be signing the consent documents, that they understand exactly what's going to happen, what the potential risks are. As minimal it might be, they just got to take note of that. Then they will be taken to the theatre, they will be prepped, they will be made comfortable on the operating table, and I will just start with my process. We will first place some fluid under the skin to numb it, and then after that we'll do the VASER phase, followed by the extraction of the fat, whether it by manual lipo or by power-assisted lipo, all part of my technology that I can apply to the best for the specific individual. And then when that's all done, we will put small dissolvable sutures in the incision points. They will be placed in their garment by the team, and they will be put in recovery, offered a cup of tea and a slice of toast, and then discharged home. I think downtime is also varies according to the area, the age of the patient, and the number of areas that we've treated. We usually generally say after the first week the worst is over. After 2 weeks they can start doing a bit of exercise again, and then after a month they can just do what they like, get back to the gym or jogging or whatever they prefer doing. In our experience, it's also a very good thing to have lymphatic drainage massages afterwards, in number anything from 3 to 10, depending on the magnitude and the nature of the procedure they had. And we also recommend our patients to wear a garment for anything between 2 weeks and 1 month post-operatively, 24/7, just to take off for a quick shower. We just know that our patients do better with the massages and also wearing the garment. And also for somebody in the form of a massage therapist to actually keep an eye on them and make sure everything goes according to plan. So that positive feedback is when a person comes in months later and they're just filled with self-confidence and they're smiling from ear to ear, they're beaming with happiness, and when they show me the results, I just have a total immersion in their feeling of well-being, and it's very pleasant actually to see that, and that's what makes it work for us to do this. Because some just want to debulk a bit, others want to have more definition, others want to target a specific little area like a chin, for example, or the cankles, the big ankles. It's often very localized to a specific anatomical region, but some of our patients want everything done. And as I said, chin, upper arms, chest, tummy, the whole lot. So there's a massive variation in what our patients present with. And I think also that we can have the availability of the VASER technology and the other technologies. We can actually treat all the different areas with safety, with good results, consistent outcomes, and minimal complications.